Hey everybody, welcome back to Kalkstein Chiropractic. Today we are going to go over stretches that help with the sciatic nerve and the pulling or pain that some people get with that tension in the back of the leg. So first I'm going to show you the soft tissue work that I do with Dale. So from my perspective, how I work on it. And then I'll show you some stretches today that we do out on the exercise floor that can help with that pulling that you can have from the sciatic nerve or pain down the back of the leg. So Dale, you just had this done for the first time last week, and you felt a release immediately and almost a sense of freedom when you walked out of here, right?
Yes, I did. I noticed it, especially walking across the parking lot. I was, my pace was speedy, like it usually or it should be. I tend to walk fast, and yeah, I noticed the difference.
We're going to go ahead and basically do just hip flexion, okay? So I'm co-treating Dale with the local MD. He's got what's called spinal stenosis. So he has pain that travels down the back of the leg, especially around the sciatic nerve, especially on the right leg. He has pain that's worse in the morning. He's been diagnosed with an MRI and through a history as well as through a physical exam here in the office. So he's on a treatment plan right now where he gets lumbar decompression, relies on a table, and the table stretches him out at a certain weight. And then he gets a set of exercises that he does here, coupled with some soft tissue work and an adjustment. So he gets those three modalities on most visits in our office. So I'm going to show you how I do soft tissue work on the sciatic nerve and the back of the leg. Anna's going to help me out. And you know what, Liam, you're probably going to want to come on the back side of me. Was a nice crossover move there, Liam. Alright, so this can be very sensitive up towards the glute. So I'm going to travel along the back of the hamstring, and then I'm just going to go straight medial to it and go over the area where I feel that sciatic nerve coming, pressing out from the middle of it between his hamstrings. Go ahead and I take him up nice and slow. Good. So neural tension is a very common thing with these type of problems, and what we're going to do to stretch that nerve or move that nerve is extend his knee all the way. And Dale, once you get to that point where you feel like you can't go any further, what I want you to do is pull your toes back towards your shin. So pull them back towards the shin the other way for me, Dale. That's it. Good. Now come back. So that's going to be your move at the end. All right, Dale? Mm-hmm. Good, go ahead. Good, up, up, up. Now extend there. Yeah. Good. Breathe in for me, Dale. Exhale. Easy, easy. Breathe out. Good. Now pull those toes back, 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 back. Good job. And point them now. Good. Point, 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 point. Other way, other direction. Good. And come back. So Dale, this is your foot at the end. You're going to come up, 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 and then you're going to point, point, point. And then up, okay? Alright. So what we're doing is we're flossing that nerve back and forth when we make those motions. Go ahead. Good. And straighten. Good. Toes back. Good. And point. Easy. Easy, slow. And point back. That's it. Good. Back in. Go ahead. Breathe in for me. Easy exhale. Breathe. Breathe out. All the way out. But don't hold on your breath. Good. Good. Point your toes. Get that toe down, 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 down. Good job. And back up towards Anna. That's it. Good job. Come back. So how do I know I'm near that nerve? When I feel him point and extend, I can feel gliding underneath my thumb in the back of his hamstring. He's not moving his knee at all. So the only structure that goes that far is the sciatic nerve and branches of the sciatic nerve. Go ahead. Good. Pull. Good. Good, back. We're going to go a little deeper here, okay, Dale? Mm-hmm. Good, now go ahead. A little pressure here, Dale.
Mm-hmm.
Breathe in. Exhale, easy. Breathe out. Let it all out. There you go. Point your toes. Good. And bring them back towards Anna. That's it. Good job. Good. Last one. Nice. So that's, Dale's tough. That's a pretty intense stretch there underneath my thumb. He's just not showing it or letting you hear it.
I'll wait till we get to the parking lot.
All right, go ahead. Right there, now extend. Good. Breathe in for me, Dale. Exhale. Point your toes and flex your head forward. Point your toes. Flex your head forward. Good. And bring your toes back. Go higher, Anna. Bring your head back. Exhale, breathe. Good. Good. Okay, so you just watched how I do some soft tissue work in the form of nerve flossing as well as a little bit of pin and stretch in the hamstring area. Now we're going to show you some stretches out there that we do when we have people that come in with this sciatic nerve tension and pain in the back of the leg. Hey everybody, welcome back. It's Dr. Warren. I'm going to show you how you could do a similar stretch that I was just doing on Dale at home if you have some pulling in the back of the leg. We give this to our patients that have that sciatic nerve tension or pulling in the back of the leg. Now just be mindful when you do this, don't overdo it. Right, there's a good amount, there's a limit to all the good things that we do. If we do too much of a good thing, sometimes it can cause some discomfort. So I tend to spend about 5 minutes doing soft tissue work on a particular area max. If I'm really hurting or acute, I tend to spend about a minute or 2 minutes. So grab yourself a lacrosse ball or a tennis ball to start if it's really sensitive. And if you're a little farther along, if you're able to handle it, you can grab yourself something firmer like baseball. Right? Just be cognizant of how much pressure you put down. So you want to create tension, but you don't want to cause pain. So if I put the ball here, I take my leg and I sit down on the ball so that it's flat on the table. Right? I'm going to roll until I find a spot that I feel tenderness right in the center of my thigh here. So if I feel some tension in a particular area, I'm going to stop. And then I'm going to put downward pressure from my hand here, and I'm going to straighten my leg. Okay? Now, this is the part that gets a little bit confusing, so stick with me here. I'm going to take about 4 or 5 passes here, just lengthening that tissue, getting my knee straight as much as possible, and then coming back in. As you come back in, you might realize that it's going to be a little bit more tender. It's because you're relaxing around the ball a little bit. You're not guarding so much. You're allowing the ball to get a little higher up into the back of the thigh. Again, I'm going to stretch. Good, and come back down. So this isn't a hamstring stretch. This is more so creating a floss of that sciatic nerve. So I'm flossing the nerve back and forth while putting some compression around it. Good, so after about the 4th or 5th one, I'm going to finish up with some movement, okay? This is important. So I'm going to point my toe, I'm going to follow my head forward as I point it. I'm going to kick my head back with my toe coming back so that I can just, you'll feel a stretch all the way through. I'm going to point my toe, I'm going to kick it forward. That loosens up some of that pulling sensation that you can get in the back of your leg. Now, if you want to take it up a notch, or if you just want this as a way of getting better mobility in your posterior chain, like I don't have like sciatic pain, but I just get tension in the back of my hamstrings, then let's go ahead and show you how to do it a little bit, like a step up, if you will. So, let me set it up so you don't have to watch me do this. yourself up at the gym, get the bar onto the rack that kind of you can rest it on, or it's supposed to be there to catch the bar if you need to drop it. So it allows you to roll, squat, rack, bar, back and forth. So what I'm going to do is I'm going to split the rack. I'm going to put that pressure from the bar on the leg, and I'm going to find a spot that I feel a little tension. Take your time with this. Don't force it, right? Be patient. Use your breath to relax into the stretch. So I'm going to show you how to do this from this perspective, right? So straighten out and come back in. Straighten out. Come back in. Supporting myself with the bar here. You can roll back and forth on the bar. This feels really good, loosening up the posterior chain of the hamstrings and freeing up tension in the sciatic nerve when I move my leg. Okay. Now I'd recommend a patient, if they had that pulling sensation, to follow it up with some dynamic movement afterwards. So that could look like a lunge, right? That could look like a squat, depending on the physical fitness of the person. It could be a dead bug on your back. So looking up some of those exercises in our other YouTube videos might be helpful for you if you have this type of problem. So if you have any questions about the stretches that I showed you, post below. And if you haven't already, subscribe to our channel, because we're going to be doing more demonstrative videos like this in the future. Thanks for watching.